This segment of DelmarvaLife is sponsored by TidalHealth.
Your heart works tirelessly, beating 100,000 times a day to keep you alive. Yet, heart disease remains the leading cause of death worldwide, often creeping up silently until it's too late. But the good news? Many cardiac issues are preventable.
And Delmarva is home to one of the top cardiac health facilities in the nation. So today, as we wrap up Heart Month, we are pleased to welcome Dr. Joseph Cinderella to the show. Dr. Cinderella is the chief of the Division of Cardiology at TidalHealth Peninsula Regional. Doctor, welcome to the show.
Well, thank you. It's great to be here.
So congratulations on being recently named chief of the Division of Cardiology. What does that role mean, and why is it so important to the hospital and the community?
Well, it's an honor and a privilege to be chief. I've been there, quite a few years. It's really a community of physicians that all work together. We're all really a community of equals, and really what I do is just run the meetings. It's nothing, no special power I have over the other cardiologists there. They're all great guys, and I think the cardiology's certainly come a long way in the last 25, 30 years since I've been there. And I guess we'll probably talk about that in the coming questions, but it's been a real honor.
So TidalHealth has a cardiology fellowship program. Tell us about your role in that and how it's shaping the future of heart health.
Yeah, we started in the last few years. It's always been a tremendous community hospital. We recognize we have great physicians there, provide great care. People don't really have to leave the shore. But a few years ago, we made the decision, and this is really nothing that the physicians alone could have done. Administration was super supportive. Steve Leonard's our CEO, and he helped drive this. But we started a medicine residency about 3 years ago, and this past summer, started a cardiology fellowship. So a fellow is someone who's completed their 3 years of internal medicine training and goes on for additional training to subspecialize, in this case, cardiology. And it's been just a tremendous plus for the hospital, and I think for myself. Working with these guys and teaching them, and it's a two-way process, has just been a lot of fun, and I really enjoy that. My role is I'm associate program director for the cardiology fellowship program, core faculty, and it's been a challenge and been fun.
Wonderful. Okay, so as we mentioned, you wear several hats within the department, but you also see patients every day.
Oh, yeah.
What is the one thing that you always tell them to prioritize when it comes to their heart health?
Well, you only have one heart, and take care of it. One thing I should say is we tend to see patients as cardiologists for primarily secondary prevention, which is after they've had their heart attack, their stroke, their event. But there's way more potential if we get them early, for primary prevention. The primary care physicians, do a lot of that, but a lot of the burden of that is on the patient to take care of themselves. Your genetics are something you're born with. You have no control over that. But there's so many things that you can do to reduce your risk for the future. Diet, exercise, no smoking, weight loss, those are all have huge potential impact, not just for today and tomorrow, but for 5, 10, 20 years later. And then you don't have to come see us. I mean, if you prevent your event, you may not need to see a cardiologist at all. So I think it's a lot of lost opportunity for primary prevention.
So you educate your patients a lot on what's going on with their heart, but what have you learned from some of your patients?
Well, everybody's different. I mean, I think the most important thing is to really, listen to the patient. They'll tell you the story, and we probably get more information just from back and forth talking than we do by any test that we do for a lot of patients. That is, taking your medicines as directed. One of the more frustrating things we see is our patients who. Internet is great, but a lot of patients come in with preconceived notions that they're going to have trouble with this medicine or that. Statins, for example. The benefit of statins to lower cholesterol is just so overwhelming, and we get the occasional patient, probably a few of them a day, who just are convinced that it's going to do more harm than good, and that's the exact opposite. So I think just compliance with medication. Your doctor gives you a medicine, there's usually a good reason for it. There's no money to be made by prescribing a statin or an aspirin. It's for the patient's good.
Sure, and that's the bottom line.
Yeah.
Everything for the patient's good. Dr. Cinderella with TidalHealth, thank you so much
No, thank you.
for coming in today.
Thank you.